Grant Garcia, one of the sports and shoulder surgeons here. Today we're going to see a video testimonial. This is a young patient, actually a pretty unusual injury. What she did was she tore the ligament off of her humerus, so it's called a HAGL, H-A-G-L. It's a lot less common than sort of the normal labral tear, and she had this undiagnosed for almost over 10 years. Her shoulder kept dislocating. She saw a number of different physicians or surgeons who, even after diagnosing it, didn't really know the best solution for this. The issue with this is there's two main approaches. One, you can do it open, which is a lot more invasive, or you can do it through a minimally invasive approach, but it's a little bit more technically challenging. Here we have specialized in that sort of area of the arthroscopy, and so we're able to do it from an arthroscopic approach. So we did it through a few different poke holes, and we're able to fix that tear, which ended up being almost 10 years old, which is pretty impressive. And you can see she had an excellent result, and she got the stability she's been waiting for over 10 years, so enjoy.
I probably had 10 years of living with a really unstable shoulder from my first dislocation to previous dislocations, and it was to the point where it was like subluxing or dislocating in my sleep, and I was in a lot of pain all the time, and I wasn't opening arms with this door or had really limited mobility, and I finally decided I couldn't live like that anymore. I did lots of PT and things to help keep my strength up, but it was not enough to have a functional life. So got some MRIs, some more imaging, and then found Dr. Garcia, who was really optimistic, which was exciting because I'd seen surgeons in the past who just thought it wasn't really a surgical. They couldn't fix my pain with surgery. So getting the first MRI results I think weren't read correctly, so it took a few tries, a few different surgeons to come up with that it was actually a HAGL tear on top of everything else and the generalized instability, which was kind of intimidating. It was exciting to think that there was possibility for it to actually be better and more sound, even though it was a unique diagnosis. Okay, so the recovery was pretty straightforward, honestly. It was a lot of the immobilization I think I just got really impatient with, but went well. Every time I was coming in, the progress was good. There was really I was never moving backwards, and I had to tell myself okay, compare this to how you actually felt before for those 10 years. And it was PT was great, lots of massage therapy, and it was a slow process, but always trending in a positive direction. And it was just wild. I think the psychological piece was different than I expected because there were so many activities and just motions and positions I never put my arm in for 10 years. So I think unwinding 10 years of that has probably really been the slow part, but it's amazing that it feels stable, and there's so many positions I'm oh, this doesn't even feel vulnerable anymore. And now 6+ months out, I do some of these things without thinking, which is really encouraging, and I'm excited to just keep regaining the strength and the mental confidence to remember that I do actually have two stable shoulders now, and can live with that. Yeah, I would definitely recommend this surgery for somebody who has the same issues as me, HAGL and labral tear and general instability. I think after living with an unstable shoulder for so long and seeing other surgeons, doctors, whoever saying yeah, probably you're not a surgical candidate, kind of messes with your mind. But this surgery actually was much, really successful in my experience, and less intimidating or less invasive than what some other surgeons I had seen put on the table with a ladder J and all of these really extreme options. And I only lost the mobility that I never needed to begin with. So that's actually a positive in terms of, I think there are some other procedures which you end up with a lot more limitations. So I would recommend it, and